Now to the new coronavirus variant that's currently ripping through India. We just learned the U.S. will be restricting travel from India beginning this Tuesday. That's May 4th.
And that same variant is now in Michigan. The Michigan Department of Health and Human Services confirmed that the variant case has been found in Clinton County. It's called the B.1.617, and it's been blamed for a deadly spread.
New infections have been surging in India and overwhelming their healthcare systems. On Wednesday alone, the country reported more than 362,000 new infections, a new global record.
Meantime, here at home, Michigan has announced 3,400 new cases and 35 additional deaths. So far, 50% of eligible residents in Michigan have received at least one dose of the vaccine, while 38% are now fully vaccinated.
And joining us now is our chief health editor, Dr. Partha Nandi. Dr. Nandi, good afternoon.
Afternoon, Alan. How are you?
I'm good, doctor. Thank you. So first of all, this is being called a double mutant variant. Can you explain what that means?
Sure, Alan. So a double mutant means that two mutations that were once separate are now together, creating a whole new strain. And while this is very concerning, we all are concerned about it, I want to emphasize that so far, there's no solid evidence that shows that B.1.617 variant is more dangerous. So that I want to make sure that point is made.
Yeah, and doctor, what about vaccines? Is there any new research about their effectiveness against this variant?
So, Alan, preliminary evidence from Israel suggests that the Pfizer vaccine is indeed effective against the double variant first found in India, but at a reduced level. Pfizer themselves have said that they included double mutants in past testing and expect the vaccine to be effective against this particular variant. But generally speaking, we feel that the vaccine will still be effective against the variants. And this is, again, why we have to stress the importance of getting vaccinated as soon as you can.
You know, Dr. Nandi, we talk about the numbers that we're seeing in India. Do you anticipate that Michigan will suffer a spike in cases and deaths like we've seen in India?
And none of us have a crystal ball, right? So I can't say with 100% certainty, but I don't think it will. And here's why. You know, many in India thought that they had herd immunity through natural infection. So they let down their guard, and massive social gatherings were occurring and likely became super spreader events in India. Compare that to Michigan, right? We know we don't have herd immunity. We know we don't. And therefore, we're not having these type of events, right? India, by the way, has only vaccinated about 2% of its population. And that's very different than Michigan, where close to 50% have had their first shot. And we don't know, first of all, also if this double variant is to blame for this complete, the spike in India that's going out of control. Yes, it's the dominant strain in India's second most populous state, which is Maharashtra, but there are other strains that are behind spikes in other parts of India. There's limited data because India doesn't gene sequence as much as we do, and we are gene sequencing. That's why we know that the British variant in our country is about 70% of our cases. In at least in Michigan, it's 70% of our cases. But again, I want to go back to the point. We have this new variant. It just goes to the point. Let's get vaccinated so we can have protection against other variants that may come through, and so we can get back to normalcy and control this virus in Michigan, in this country.
Yeah, that's the big thing. A lot of us want to get back to normalcy, so we have to get that vaccine and we have to continue to follow those health standards. All right, Dr. Nandi, thank you so much.
My pleasure.
Dave?